what is the kind of first aid that must be given to these kind of patients who are having heart attacks? I mean, what should the relatives know?
Whether it is heart pain or pain originating from heart or not, the benefit of doubt should be given to that individual. Whatever may be the age, what first should be done is try and make that person relax. Loosen the clothes, take the help of the person who is beside you, and try to ask the person to make him pop up a tablet of aspirin. Over the counter aspirin tablets are available. We in general feel our pulse. If you feel that that person is having good pulse which is felt, it's not difficult. If you try, you can definitely feel that. If the pulse is well felt, try to give one sorbitrate tablet. Now, in general, everybody knows about what is aspirin and what is sorbitrate. Most of the people in their families have heart-related patients, so we have knowledge about aspirin and sorbitrate. If you feel that a person is sweating profusely, do not give sorbitrate. It might be a marker of very low blood pressure. If the pulse is not felt and a person is profusely sweating, if you give sorbitrate underneath tongue, it will reduce your blood pressure more. It will create more harm rather than benefiting you. But definitely aspirin is the first thing. Without wasting a single minute, you should give. Ask that person to chew the tablet of aspirin. If it is not possible, if a person is not used to, then powder can be made, and with little 1/4 glass of water or half cup of water, you can ask the person to swallow. This is a poor man's thrombolytic agent. Thrombolytic agent means it is a clot dissolver. We go to hospital, we rush that patient to the hospital. Before that, actually, some people who have this tablet in time might develop complete dissolution of the clot. So this is a lucky subset which we see sometimes when these people approach to the hospital if they receive timely aspirin. Now, when a person comes to hospital, we start the therapy, but before coming to the hospital, before the patient reaches a medical facility, what should be done is, this is most important: aspirin, sorbitrate, try to loosen out clothes, make that person completely relax, give good breeze of air with a fan or something. The person should be moved in an area where there is good ventilation. If a person is very breathless, now this is very important for us to understand. If a person is very breathless, do not ask that person to lie down flat. Ask the person to be reclined on a sofa till the time patient reaches a medical facility. Even in an ambulance or moving vehicle or a car or a personal vehicle, that person should not be lying down flat. Person should be made to recline or sit back upright and asked to cough out. This is very important. Now, when we say that that person has to cough out, how it is going to help is, when we make a person cough out repeatedly in between the deep normal breaths, what it helps is, it helps to squeeze out the lungs, to ventilate the lungs properly. It gives you good oxygen. In heart attack, 25% of the patients, they develop sudden accumulation of water into the lungs. This is called a left ventricular failure. That's the reason behind the breathlessness, actual breathing difficulty. When a person coughs out, when a person takes deliberately deep breaths, this water is squeezed out of the lung air spaces, and it helps aid you getting ventilated properly, maintaining your oxygen saturation till the time you reach the medical facility. But at home oxygen is not possible, so giving oxygen, it will be definitely a boon to a person immediately if you diagnose a person with a heart problem. So start on oxygen.
So how soon should one get the person to the hospital after heart attack?
Heart is an end organ, as I said earlier. Now, heart has a time limit to be taken care of. Within that time frame, the person should receive medical benefit. Same way, brain, retinal cells, kidney cells, they have a window period. Now, if you want to give complete advantage to a patient who is receiving treatment, person should be rushed to the hospital in 1 hour. Not less than 90 minutes, person should receive emergency treatment. Maybe it is thrombolytic intravenous injection or angiography, angioplasty, or whatever therapy you give.
Thank you, doctor. We've learned a lot today, and thanks for coming.
Okay, I should thank you. Thank you.
For more such information related to your health, log on to health.india.com.